Hello, it's Dr. Rhonda Johnson, and today is Thursday, August 20th, 2020. And today I'm going to be discussing what I think are some discrepancies in the number of reported cases here in the United States. I'm also going to be talking about psychological and sociologists, what they're saying around why certain populations may be responding to this pandemic the way they are. But let's just first start off with the numbers. Well, our confirmed cases of positive cases in the United States sits at over 5.7 million. And the number of deaths that are positive and confirmed are at 176,000 as of today. Now, in spite of this, one of the White House administration physicians who oversees testing here in this country said during a telebriefing that the number of cases are declining here in the United States. But again, I'm questioning and I'm skeptical about this because there have been months of testing shortages due to a lack of tests being available, components being available, testing labs being overwhelmed. So here are some facts. Well, the top 10 COVID-19 clusters by mid-August were the jails, the prisons, and other detention centers. And what we know is that the number of COVID-19 deaths among inmates and correctional officers passed 1,000, with more than 160,000 infected. Now, data on the incarcerated population is extremely unreliable because states don't always report it, and they really don't report the breakdown of the cases by demographics, by race and ethnicity. And only 4 states report it: Vermont, Tennessee, Massachusetts, and Washington. We continue to see hotspots in the United States, with California, Florida, Texas, Arizona, and Georgia being the current hotspots in terms of states with the number of most active cases and deaths. And now we're seeing a rise in coronavirus cases amongst colleges and universities. As of today, we have 15 colleges and universities that are reporting positive cases: Colorado College, University of Connecticut, University of Georgia, University of Notre Dame, Iowa State University. 5 colleges in Kansas are reporting positive cases. In Kentucky, University of Kentucky and Western Kentucky University, the prestigious Boston University, and Emerson College. In Mississippi, 3 schools, including University of Mississippi, are reporting positive cases. In North Carolina, you've got East Carolina University, North Carolina State University, and University of North Carolina at Chapel Hill. All over the country. In Oklahoma, you've got Oklahoma State and the University of Oklahoma. Here in my state of Pennsylvania, Temple University is reporting positive cases. In Tennessee, it's the University of Tennessee. Virginia Tech is reporting cases, and West Virginia State University in West Virginia is reporting cases. So again, we can only expect these numbers to rise as colleges and universities try to maintain in-person learning. So I'm going to move into the psychological response to this pandemic, because this might help explain what's going on with some of our young adults. You know, we're continuing to see different reactions amongst Americans to this pandemic. And what some sociologists and psychologists are saying is those who have personally been impacted are much more likely to take this pandemic serious and be more cautious in their behavior. So those who don't have a personal connection to this, they may feel invulnerable to this. So, which brings me to a discussion of young adults. You know, originally it was all said that this pandemic was mostly going to affect the elderly. And again, a disproportionately of elderly have died. So, we've seen young people out on the beaches, in the bars, crowding, college students going to all these parties. And yes, now their cases are rising. And many young people, as they get this infection and experiences the hardships of COVID-19 infection, are now saying they just didn't take this seriously. And you see more and more information about young people telling other young adults to take this seriously. Well, here's what the sociologists are saying is going on. That a possible explanation for these behaviors is that young adults have been experiencing more psychological stress and loneliness during COVID-19, and they are seeking social companionship. Thus, they may have a bigger sense of invulnerability. It may be more pronounced among the younger age groups, and particularly among non-minority young people, because they have experienced a smaller proportion of cases and deaths amongst them. And they may not personally relate to all of these people who have been dying and affected by this pandemic. They may have a false sense of security. But this is likely to change as more and more young people across more and more demographic groups experience this infection and the aftermath of COVID-19 in terms of the side effects and the prolonged period of recovery. So we just have to see what happens, unfortunately. Now, Dr. Fauci and other experts are predicting that the death toll is going to hit 200,000 by early fall. This is just really unthinkable. And it brings me to say, if we do not value the loss of lives of those who have already passed on, then we as a society are not going to value the lives of those that are bound to be affected. Now, I know that's not everybody, but it certainly exists in some circles, doesn't it? Now, we have to remember that Blacks and Hispanics, African Americans, and Latinx groups have had 4 to 9 times higher the rates of death from COVID-19 than whites. And I forgot to mention Native Americans, who are just being decimated in this pandemic. Sociologists are now saying that the vast scale of COVID-19 has the potential to lower educational achievement amongst our youth, disrupt marriages and families, and lead to poor physical and mental health across all age groups. So we're going to be feeling the effects of this for some time. So I know it's not good news, but we're going to have to stay the course and do everything that we can to keep ourselves safe and well and avoid this pandemic. Stay the course, folks. Practice the 3 W's. Avoid the crowds. As the holiday comes up, holiday weekend, stay the course. I know it's tough, but this is not going away. We have to prepare for the long game right now, today. This is Dr. Rhonda Johnson. My views are my own. And stay safe, and stay connected, and stay alive. Have a blessed day.